Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Today, I'm going to tell you a little bit about the medication glipizide, the dosage, 5 and 10 milligrams, and some of the side effects associated, potential side effects associated with this medication. First off, what is glipizide? It's in a class of diabetic medications called sulfonylureas. In the US, it's sold under the brand name Glucotrol and then the extended release form Glucotrol XL. What it does, it causes the pancreas to secrete more insulin. It also appears to reduce the amount of glucose produced by the liver. And then over time, as you take this, there may be some insulin sensitivity that's improved. So what are the doses we typically see with glipizide? The regular release, you start with 5 to 10 milligrams per day, generally split into 2 doses, not exceeding 40 milligrams a day. And the dose is best on an empty stomach 30 minutes before eating. Extended release, usually in that 5 to 10 milligram per day range, but we're looking at a max usually of 20 milligrams a day on the extended release, and that is typically taken with breakfast. And when you are affecting your blood sugar, it really is good if you can monitor that to make sure it's effective and to watch that it doesn't take your blood sugar too low. Some of the common side effects we can see with glipizide, uh, people will complain of fatigue or low energy, low blood sugar, potentially seriously low blood sugar, nausea, dizziness, tremor. It can cause diarrhea or constipation depending on the person. As a whole, most people do fine with this medicine, so we don't see a ton of these happening, but you just need to be aware of them. Anxiety, insomnia, and others can occur. You be aware of the side effects, so if you notice them, you can talk to your provider, your GP, your doctor, your nurse practitioner, and just, discuss the potential side effects you may be having. Rarely, we can see some liver toxicity, a disulfiram-like reaction. That's basically where you feel like you have the flu, you're nauseous, you're vomiting, you just overall feel really, really bad. And certain blood issues, some anemia can occur with these. What about glipizide and metformin? They are often used together. Metformin is typically our first line agent for type 2 diabetics or even pre-diabetes. Um, and then when that's not enough, they will then add in the glipizide because they work in different ways to control blood sugar. So we do see them used together. And glipizide is usually it's most effective early in the disease of type 2 diabetes. As your pancreas starts to wear out, it becomes less and less effective. Um, so the longer you've had type 2 diabetes, potentially the less useful glipizide will be for you. Alcohol. You want to avoid alcohol altogether if you're on glipizide. Just a bad idea to have alcohol with glipizide. Not only will the alcohol lower your blood sugar, but it can cause that disulfiram-like reaction that we talked about where you just feel terrible. You basically feel like you have the flu. Just not going to be worth it. And if you're trying to control your blood sugar, alcohol is not going to do you any favors. So just keep that in mind. Glipizide and weight gain, yes. Yes, weight gain can occur with the sulfonylurea. Simply, you're increasing the amount of insulin circulating in the system. Insulin can promote fat storage. So you can put on weight with this medication. If that's a concern, be sure to chat with your doctor about that. What about sulfa allergy? Yes, it is not recommended if you have a true sulfonamide allergy. So you can kind of chat with your doctor, your healthcare provider, determine whether you had a true allergy, whether they want to try it, or if it's not worth the risk and you need to try something different. Now, I wanted to touch on symptoms of low blood sugar again, because that is really a concern with glipizide. If for some reason you're not going to eat, if you're sick, and just not going to take in any food or calories over the day, it's generally recommended that you skip your glipizide dose because it can just drop your blood sugar too low. So the symptoms that we want to watch for of low blood sugar would be you're just nauseous, you're sweating. If it's really bad, you can lose consciousness, you can be shaky, tremor, lightheaded, all signs of low blood sugar. Hopefully you have a blood sugar meter. You can check your blood sugar, but some hard candy or some non-diet soda or fruit juice can bring your blood sugar up, and help you through the symptoms of low blood sugar. So just be aware of that and watch for it. I appreciate you watching. Be sure you always speak to your healthcare provider if you're having problems or side effects with this medication. And I would encourage you to consider dietary and lifestyle changes. Medications like glipizide are fantastic, but a little bit of physical exercise every day. We're not talking huge exercise, 15-minute walk, maybe some resistance training a couple times a week can make huge changes in your disease state, your type 2 diabetes, and get rid of some of the food that can worsen it. We're talking, if you're diabetic, you're not doing yourself any favors drinking calories, soda, fruit juice, things like that. It's just a lot. You can take in a lot of calories. It's digested quickly, so it spikes your blood sugar. Often, like crackers and some of those snack foods do the same thing. They're just so highly processed. When you're diabetic, they get into your system so very quickly, and your system can't handle all those carbohydrates absorbed at once, and so that's where you get the high blood sugar. And over time, that high blood sugar, it's hard on your eyes, it's hard on your kidneys. You can lose toes and hands and feet. It just realize that you can make some small changes in your diet and lifestyle that can have tremendous effect on the diabetes. So thanks for watching. Subscribe to my channel. I would appreciate it if you appreciate my videos. And thanks again for watching.